were anticipating when we closed August financials to lose money.
Since the beginning of the COVID-19 pandemic, Asante has helped lift the financial burden off COVID patients.
We've written off millions of dollars that we historically would have requested from the patient.
Asante's director of finance, Heather Rowenhorst, says the hospital gets a flat rate from insurance companies, averaging about $14,000 per patient. After that, the hospital writes off the remaining expense. Usually, the flat rate would be enough, but with the recent surge overwhelming Asante's hospitals, it's now putting a strain on Asante's finances.
We're kind of in the spot where we may need to reevaluate that approach.
Asante says it's seen major increases in costs the past couple of months. One being labor. Many frontline medical workers are putting in additional shifts day after day.
That's millions of dollars of premium that we're paying out that historically we didn't have to pay out.
Asante usually budgets $100,000 for travel medical workers. They're now spending almost $400,000.
We have tried to supplement with as many traveler nurses as possible. That comes at a significant cost.
A cost she says is well worth it, just to give their regular workers a break.
They put in some hours, they work hard, they're dealing with families that are experiencing some of the worst possible things in their life.
Asante is also covering pharmaceuticals for COVID-19 patients, which can range from $5,000 to $6,000 per visit, not to mention lab work. Each COVID test costs Asante $25. If they outsource the test, it's an additional $65. Last week alone, they spent about $200,000 just on COVID tests.
Sometimes we get reimbursed on that and sometimes we don't. Like if it's within the inpatient setting, it's just rolled up in that flat fee. On the outpatient side, there we do get some reimbursement.
In addition to labor, labs, and pharmaceuticals, hospitals are paying for an enormous amount of PPE, extra beds, and oxygen. They're also canceling elective surgeries, something that actually makes the hospital money.
August financials will not look good. July's financials were not good. And that was before kind of this bigger surge.
Asante says something has got to change within our community for them to come out on the other end of this pandemic.
We're just really hoping that folks start believing and getting their vaccines so that we can be done with this.